Okay.
Okay, so for our project, we're doing electrode-induced glial cell differentiation for responsive neurostimulation. I'm Mary.
I'm Christine.
And I'm Stephanie. So the clinical need for this is we're trying to treat seizures. So seizures are a sudden surge of electrical activity, and that can be with or without warning. It can also be with or without convulsions. 5% of children experience seizures before the age of 20, and epilepsy is defined as multiple seizures over a long period of time. So the first option of treatment is medications. However, more than 30% of epileptic patients are likely to have drug resistance to these medications, so that's not an option. The next option would be vagus nerve stimulation, which has timed release of signals to the brain throughout the day, and if a patient notices the onset of a seizure, they can wave a magnet over the box, and that will send extra signals to stop the seizure in its tracks. However, that is only effective for about 50% of patients. So the next option is RNS, or responsive neurostimulation. However, that still has limitations, such as it's a very invasive surgery and is also only available for patients that are 18 years or older. So there's still a pressing need for better treatment of seizures to increase the quality of life for epileptic patients.
So the approach that we're going to use is using growth factor eluted electrodes in the RNS system that we talked about earlier. So RNS systems tend to form glial scars in the brain after the operation, and we're trying to reduce the formation of glial scars. So how we're going to do this? We are going to use the growth factor GDNF, which stands for glial cell and derived neurotrophic factor, and we chose this because it's neuroprotective and it's specific to glial cells, and therefore it will only promote differentiation in glial cells. And therefore, so we're going to use a polymer matrix to do this, and so we're going to coat the electrodes with the polymer, which contains the growth factor. And so when it's inserted in the brain during surgery, then it will control release the growth factor as time goes on. And an extension of our approach is using magnetic operated battery cells, so that the patients do not have to go back in for surgery after 3 years, which is what happens with the RNS system.
Okay, so some benefits for our system is that it will hopefully limit the glial scarring that occurs with the RNS system at the electrodes. And this is important because the glial scarring can cause impedance for these electrodes, and removing these scars would just overall increase the effectiveness of the RNS system. It will also hopefully reduce the infection and inflammation, which occurs in approximately 9% of patients over a 5.5-year period. So some costs we have to take into consideration. This is a cell-based therapy, so our research is dependent on the individual patient cells, and we have to take that into consideration. Also, we want to be able to make sure that our product is safe and effective. And since it is a combination device, we have to put in the time and resources to get this approved by the FDA. Some competition that we have, the Cyberonics Aspire SR is a type of vagus nerve stimulation, which measures changes in the heart rate. And this is effective in 43% of the patients over a 3-year period. The downside to vagus nerve stimulation, though, is many patients don't have a noticeable change in their seizure patterns for about 2 years. The NeuroPace responsive neurostimulation, or the RNS device, so that's the direct brain stimulation and what we're planning on kind of building off of. There's 66% of patients experience a decrease in seizures in approximately 3 years. The downside to this device is that it creates glial scarring at the electrodes.
Thank you.